What I'm about to tell you about the aesthetics industry should absolutely terrify you. 90% of aesthetics providers have no idea what they're doing. And even worse, sometimes there's absolutely no consequence to them if they hurt or botch you. In this video, I'm going to explain the dirty little secrets that medispas don't want you to know, and how aesthetic providers can get away with hurting you with little to no consequence to them, and why it's more important now than ever to understand how this industry works, to protect yourselves, protect your loved ones from complications, mismanaged treatments, and bad outcomes. If you don't watch this video through to the end, then you honestly may as well stop getting aesthetics treatments altogether, because if you're making any of the mistakes that I discussed in this video, the chances are higher now more than ever that you may be one of the individuals to suffer the lifelong consequences from mismanaged treatments and complications. So stick with me, and I'm going to tell you the truth about the aesthetics industry. Let's get into it. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, double fellowship-trained procedural and cosmetic dermatologist in Newport Beach, California. And today, this video is very near and dear to my heart because I so badly want to protect you guys from the complications and mismanaged treatments that happen when you have procedures performed by a less than highly trained provider. And in my clinic, I see complications all the time from other offices sending me irreversible complications that sometimes I can't fix. And so that was my motivation to film this video today, because I can't stop aesthetic providers who don't have the training or level of education to perform these procedures. But what I can do is I can educate you guys, empower you, and share knowledge to hopefully decrease your risk so that you're a little bit more informed and a little bit more knowledgeable to avoid a potential complication or mismanaged treatment. So I said that 90% of aesthetic providers don't know what they're doing, and this number may sound shocking to you, but when you understand how the industry works, you'll understand that 90% of the people out there providing aesthetic treatments don't have the proper level of training. And since the popularity of the industry is fairly new, the public is not yet aware of what it actually takes to become an aesthetics provider. The fact is, it's actually pretty easy to become an aesthetics provider because the cosmetic industry is a hybrid between the beauty industry and the medical practice, and it's just this gray area where you don't have to provide credentialing like you do to practice other areas of medicine. You can just open a medispa and start injecting botox, and the patients will have no idea how to check your background information to see that you're a qualified injector, because on their website they may see, oh, I've been a nursing injector for 20 years. Well, you've been a nurse for 20 years in a pediatric ICU helping babies, but you haven't been injecting Botox into cash-paying patients who are trusting you with their face for more than a week. And there's no way to tell by just looking at a website, which can be very alarming. It's easier now more than ever to become aesthetics provider. You can go online and take an aesthetics course with no guarantee how reputable that course is. And sometimes when I go online and I'm looking at these injectable courses, they're teaching the wrong treatments and they're teaching the wrong injection sites. And when they say this is how you do a brow lift, this is actually how you drop the brow. And when I see patients coming into my office with complications and dropped lids after Botox, and then I see these online courses teaching the wrong techniques, it's just is very alarming, and I feel that I needed to increase awareness of this increasing problem that we're seeing in cosmetic dermatology. This is why most of the aesthetic providers in medispas and these type of clinics aren't really highly trained in the area and don't know what they're doing and can actually hurt and botch you. I talk about this in my other video, how to find an aesthetic injector. Practitioners are flocking to this industry because there's so much money to be made in it. It's a multi-billion-dollar industry, and it's growing at an alarming rate. And there are more people wanting aesthetics treatments than there are highly skilled providers to provide these treatments. So what happens is people cross over from other specialties into cosmetic dermatology that don't have the traditional training. People will just take an online course or learn it on YouTube or take a weekend course that doesn't even really have any accountability or a credentialing the level of the course. When I go in to teach the providers and correct their mistakes when they have a high level of complications, I often ask, where did you learn how to inject? Where did you learn this? And they'll say, oh, well, that was my first patient, or I just started, or I learned it on YouTube. And when you compare that to 15 to 20 years of school, you can't compare the two. But the problem is, by looking at a website or an Instagram, you can't tell their level of training, and it can be very misleading. You used to have a medical license, but now even nurse practitioners or nursing licenses will call them a doctor of nursing, and they'll introduce themselves as doctor and they'll wear a white coat. And I feel that could be misleading, but that's fine. And they may not have any experiences being a nurse injector. They may have been in a CCU or an ICU for the last 15 years, and they just started doing Botox last week, and you wouldn't be able to tell by the office or the website. So hopefully knowing the questions to ask and what to look for will protect you guys from having a less than highly trained provider, because when it comes to lasers and your face and injectables, you don't want anyone who's not highly skilled touching your face. So anyone can buy a laser online and start just using it on patients. Just because someone has the equipment or the injectables or the lasers or devices and they have a nursing license or even a medical license to open a medispa, it doesn't mean they have the proper training and education to actually perform these procedures. In fact, a lot of medispas will offer a lot of money to physicians. I was even offered money by medispas when I first graduated to be paid to just oversee these medical clinics and these medispas. I didn't have to be even in that same state. And what happens is these medispas will pay out these doctors to oversee their clinics, but the doctors are oftentimes ER doctors or neurologists or pathologists without any education in aesthetics, but they're getting paid to use their license to operate their medispa. And that's just very alarming, because a lot of physicians will do that. They'll, overlook or oversee 4, 5, 6 medispas all over the country, and they're off traveling in some other country, getting paid to oversee these medispas. And I don't know of any of my colleagues personally who have done this, but I've been approached by medispas, so I know that it happens. And I do think that that's an important question to maybe ask, when you're having a treatment in a medispa. Who's overseeing this clinic? Where's the doctor? Are they on site? Are they trained in dermatology or aesthetics? Do they have laser fellowship training? And these are the questions. This is how I want you guys to think as smarter patients to protect yourselves. Here's the sad truth about the aesthetics industry. It's more of a competition on marketing than it is on the qualifications of the provider. You could be the best, most highly trained injector in your city or your state, but if you don't have the marketing or the website or the social media presence, you won't get clients or patients through the door. On the contrary, you can have a booming Instagram, a very misleading website, and get a lot of patients through the door. And when people catch on because they're not getting the best outcomes or they won't get the best results, they probably won't come back to you for a second or third time like they will if you're a very highly trained, skilled provider with great outcomes. But a lot of times these providers don't care. They just want to get their first time clients in. They just want to get your foot in the door, and they want to offer you packages because they know you probably won't return as a patient because you loved your outcome, but because you're roped in by a membership or a package, you'll come back for subsequent treatments. So it's all about the marketing in the aesthetics industry, and it's less about the level of training and expertise. So by looking at the website and looking at credentials, you can kind of see your way through and can kind of figure out who the best provider will be for you, because it shouldn't be marketing over expertise. It should be the opposite, but unfortunately it's not. So medical providers, including doctors and nurses, and now even estheticians in some states, are flocking to this industry because there's so much money to be made in it. But the problem is most of them have not taken the traditional course or level of training to inject Botox, to perform lasers, to inject fillers or chemical peels or any other treatments that they provide in the office. And when something bad happens, it's not like you can report them to the medical board, or you can't really report them to the American Board of Dermatology because they're not board certified in the first place, or they don't have a medical degree, or they don't have a credentialing or a license to be taken away. So hopefully by knowing what to look for, you'll be smarter about who you choose as your provider, because social media, websites, Yelp, Instagram can be very misleading when it comes to credentials. Half the board certified dermatologists are not actually board certified in dermatology. They're board certified in family practice or family medicine or pediatrics, but they chose to go into the cosmetic industry because it's more lucrative. There's no insurance that you have to deal with, and it's a very booming industry. And especially after COVID, the changes that COVID has caused in our hospitals and in the medical specialties, a lot of providers don't want to practice in their specialty anymore. So they're crossing over into cosmetic dermatology at an alarming rate. Dermatology is one of the hardest specialties to match in, and it's actually only about the top 2% of a medical school class that enters the dermatology program and completes a dermatology residency. body. So we're very few and far between, and knowing how to spot the real dermatologists and the real experts from the non-skin experts can be very hard to do by just looking at a website. You could be the best aesthetics provider in your city or in your town or even in your state, but if you don't know how to market yourself, you'll be beaten out by some other provider who has less training and less experience and skill, but has the marketing to bring patients through the door. And that brings me to my next point, which is, hey guys, if you're liking this video so far, be sure to click the thumbs up button and subscribe to my channel. Your support means the world to me. Okay, back to the video for you and back to the beach for me. Many patients are enticed by lower price points, but are cheap aesthetic procedures even worth it? Here are 2 things you should know about cheap cosmetic procedures. Cheaper prices mean the provider can't command higher prices for a reason. They're less highly trained than someone that charges higher price points after years of schooling. The treatment sometimes won't be as cheap as you think because it often results in complications or bad outcomes in which you would need to see an expert like myself to reverse, which can get very expensive should you have to have lasers to reverse scarring or dissolving filler, or even worse, a complication that lands you in the burn unit or in the ICU in a hospital because of a vascular occlusion or a laser burn. And when you're getting cheaper treatments, another thing that can happen is corners are often being cut. This is something that I've seen as being a trainer and educator, going and trying to teach medispas who are having problems or complications, trying to rectify the situation, and I see what goes on behind the scenes sometimes. People are watering down their botox, they're blending their filler, meaning they're mixing it with saline to water it down to get more use out of the product with less overhead. But what that results in, the botox not lasting, the botox migrating, the filler looking all weird and fluctuant and not lasting either. Your lips look great when you leave the office, but then a month later they're deflated again because you mainly got injected with saline or something that blended out or thinned out that product. And these treatments end up not saving you money because although they look great at $8 a unit Botox, they're really not cheaper because you're having to go in more frequent for more frequent treatments. And also what you don't realize is that sometimes medispas trick you into buying treatments because they wrap you into a package or a membership. They're not bringing you back as patients because you were happy with your treatment, but more so because, okay, well, I've had one treatment, it didn't really work, but I have to go back for my 3rd and 4th treatment or my 2nd and 3rd treatment because I'm already roped into a package and I've already paid for it. That's not the way to do business. I always say as a provider, if someone's offering you a package, just question why. You should be coming back as a patient because you loved your results, not because you feel obligated to because you've already paid for it. Let's talk about the social media scam. In today's world of social media and marketing, many consumers forget that just because someone has a cute Instagram does not mean they're a highly qualified injector or provider. Someone's social media following has absolutely zero indicator of their level of training, and that's really important to remember. In addition, medispas will often use other patients or other providers before and afters because they don't have any of their own, either because they don't have enough patients or because they don't have enough good outcomes. And even me personally, I've seen my before and afters of my own patients who I've treated on other people's websites, and we have to contact them and it becomes a whole huge deal. I probably should watermark my before and afters, but it does happen out there. It's happened to a lot of my colleagues too. You know, one of my colleagues who's an oculoplastic surgeon, another one who's a plastic surgeon, have to, you know, get in it with other medispas who are posting their before and afters, their surgeries, their work. So just understand that you can't always believe a before and after. The next point is the most concerning one of all, and you guys really need to know this. Many providers at medispa perform procedures that they're not trained to do. And even worse, if they should have a complication, they do not know how to reverse it. And in those cases where there are complications, they can completely abandon the patient and send them to the ER or send them to someone like me. And you, as the patient, have absolutely no recourse because you signed a waiver prior to the procedure. I always say, as a provider, if you can't reverse your own complication, should it happen, you shouldn't be performing that procedure in the first place. Just be really careful when selecting an aesthetic provider, whether it's for an injectable, a laser procedure, a chemical peel, anything that could possibly go wrong. Be sure that you select someone who's highly trained and can reverse a complication should it happen. And if you need more information, refer to my other video on how to find a cosmetic provider. It's your face, you guys. You owe it to yourselves to only be treated by the best. This last and final point is the most important point of all. The medical board has no regulation over medispas or clinics with unlicensed providers, and there's a lot of them out there. So we often call it the Wild West out there because there is no jurisdiction that the American Board of Dermatology, the American Board of Facial Plastic Surgery has over these unlicensed providers. This became a topic that has been increasing awareness at a lot of our medical conferences and our dermatology and aesthetic conferences. And just 2 weeks ago at a large medical conference, there was an attending from Mass General who was presenting a case where there was a horrific vascular occlusion, which happened to a patient who was treated in some medispa somewhere, and the highest credential of the patient, the provider in this medispa was a esthetician. So estheticians have to go to 100, I think, hours of cosmetology school in some states, and that was the highest level of training of this provider in this clinic. So that's a lot different than 4 years of medical school, 4 years of residency, and then 2 years of fellowship on top of that. And there was no accountability either. The clinic had this complication and sent the patient right over to Mass General because the doctors get referred these complications to just fix it when things go wrong. The patient's note was written on a paper towel. It wasn't an electronic medical record or anything professional or understandable. It was written on a paper towel, and half the products that were used on the patients were misspelled and mislabeled. And when the attending at Mass General at Harvard called the medispa to ask exactly what happened, what have you done, has any intervention been made so far, the clinic basically didn't answer the phone and completely abandoned the patient, wouldn't answer the phone calls from the treating provider at this time, managing the complications. And it was a multi-service specialty. They had to get multiple specialties on board to save this patient, and the attendings at Mass General had called the medical board to report them. The medical board was like, what do you want us to do? It's not like they have a license we can take away. They're not under our jurisdiction because they're not providers and they're not licensed. So there's no ramifications or reprimanding for complications gone wrong and patient abandonment and these irreversible outcomes. Once this case was presented in front of the meeting, a lot of our colleagues got up and were kind of sharing stories, and we were realizing what a horrific problem it's becoming. And the problem is that these providers have no accountability. The medical board has no jurisdiction off of taking their licenses away or remediating them or suspending their license. Patients are usually left abandoned with nobody to go to, and they're left to seek help on their own, which can be very expensive and can sometimes be life-threatening and irreversible at times. Some examples of the Wild West out there. Just this month, one patient was flown in to see me because she had horrific scarring on her face from a chemical peel that was done under anesthesia, and it was done by an untrained professional, and she ended up in the burn unit in the ICU and now has horrific scarring on her face. She's a beautiful 32-year-old woman and now has disfiguring scarring on her face, and she came to me to fix it. And most of these changes are going to be irreversible. We're doing a combination of various lasers on her to make her look and appear better, but there's no way that we can ever bring her back to how she was, and this should have never happened in the first place. Another patient that had come in to see me just a few weeks ago was a beautiful 28-year-old Fitzpatrick 4 skin type. She was of Indian descent with beautiful olive skin tones and had laser hair removal on her legs and was mismanaged, and the correct settings were not used, and she has horrific scarring on her lower extremities with depigmented and keloidal plaques on her legs. And there's no amount of lasers that I'm going to be able to do to bring her back to how she was before. And she's young and she's beautiful, and she can no longer wear skirts or dresses because she will not show her legs. So these are the things that we see as the providers when bad outcomes happen, and I'm seeing enough of these to where I wanted to do a video to just discuss them with you and just to increase awareness. It is the Wild West out there. I don't say these things to scare you. I'm just educating and sharing experiences so that these things won't happen to you and so that you can protect yourself. And I've dedicated an entire video just on how to find the right aesthetic provider if you want to watch that video to get more information. Thank you so much for watching. I hope you liked this video, and please drop a comment in the comment section and share your experiences. If you had a bad outcome or a complication, I think sharing experiences is really important, and it's a great way to educate ourselves and to protect ourselves from bad things happening. And as always, I appreciate your support. As always, my content is non-sponsored, so the only way to grow is to like and subscribe and share this channel with anyone else who wants non-sponsored content. Thank you so much, guys. I'll see you next week.